So we actually started receiving requests for workforce productivity tracking several years prior to COVID. It's definitely accelerated as more providers shifted to work from home through the pandemic. But revenue cycle leaders have been looking for ways to track worker productivity, time and attendance, and work quality going back to when we first started VisiQuate. The data that was coming out of Harvard at the time found that employees whose performance was tracked and who received feedback experienced a 16% increase in their productivity and a much higher retention rate. So we wanted to create a solution that brought those benefits specifically to the RCM space. And now with revenue cycle staffing being such a challenge, it's become critical for health systems to optimize the resources that they have. So at a basic level, we're tracking things like accounts processed, number of touches, touches per hour, touches per dollar, time clock punches, late ins, early outs, and a variety of measures around work quality. So basically, managers want to know who's getting their work done and who's not, and which processes are producing and which need to be evaluated for improvement. It's really being able to hone in on things like what touches, processes, appeal templates are effective and which aren't. What that really translates to is a significant opportunity for optimization. Over the years that we've been developing workforce performance analytics, we've been able to add significant enhancements like peer comparison, gamification, and more recently, we've built the tools that allow providers to track workforce performance even when portions of their staff are outsourced. So essentially vendor performance analytics, where you can compare vendor results against contract KPIs and audit commission payments against actual outputs. And with the advanced version of the solution, now we're able to compare absentee rates with employee productivity and measure the quality of each associate's work in each individual process flow. So really taking the insights further to support continuous improvement. You know, it's interesting, there's this 3-element combination of goal setting, tracking, and feedback that we're seeing has a huge impact on essentially every measure of revenue cycle staff performance. The feedback we've been getting from our clients really is speaking to a significant value add for their RCM operations. This has definitely been a game changer for our partners, and we're very excited to be having this kind of direct impact, reducing labor costs, increasing productivity, and creating a better experience for associates in healthcare financial management.